Today's class is on the blood supply to the heart. So we look into the heart which has got the blood supply to it. In the previous two class we have looked into the one about the external features of the heart. Then we have looked into the interior of the heart in detail. So this class we are looking about the blood supply to heart. So if you look the arterial supply of the heart, like if you look the chambers, the heart is supplied by two arteries. They called as the right and the left coronary artery. The heart itself, okay, the heart is supplied by these two arteries. They are called as the right and the left coronary artery. Coronary means to the heart, okay. We call it as right and the left coronary arteries. So first we look about the right coronary artery. So if you look at the artery, always you have to mention, okay, from where the origin of the artery takes place, from where it takes origin, then how the artery goes, that is called as the course of the artery, and the last it is like what are the branches arising from it. So remember, right coronary artery first you have to mention about the origin, from where it is taking its origin. Next, the course of the artery, how it goes, and the last is about the branches of the artery. So first we look about the right coronary artery. First about origin. Yeah, origin. See you can see here this is about the artery which I am talking about, that is called as the right coronary artery. The right coronary artery arises from anterior aortic sinus of ascending aorta. You can see this is a ascending aorta what you're looking there. So this artery arises from anterior aortic sinus of ascending aorta. This is a ascending aorta you're looking, so it arises from anterior aortic sinus of ascending aorta. So that is the origin. Next we'll come into the course of the artery, means how the artery runs, how the course of the artery is there. First, the artery appears between, see you can see the artery appears between right auricle and the pulmonary trunk. You can see here, this is the right, the artery appears between right auricle and the pulmonary trunk and passes into right anterior coronary sulcus. So it runs in the, you can see here in the groove, this is called as the atrioventricular groove. So you can tell that the right coronary artery runs downwards in anterior atrioventricular groove. Then it reaches the inferior margin of the heart, then winds round it to the diaphragmatic surface and runs in posterior atrioventricular groove. See, this is the posterior atrioventricular groove. So you can see, if I tell you again the course of the artery appears between right auricle and the pulmonary trunk, and then it passes in the anterior atrioventricular groove. It descends obliquely downwards towards the lower part of the right border and curves round its border and enter the posterior coronary sulcus, or you can do posterior atrioventricular groove. Posterior coronary sulcus is also called a posterior atrioventricular groove. Then after that ends by anastomosis with circumflex branch or left coronary artery. You can see here this is what you're looking, and then it anastomosis with circumflex branch of the left coronary artery. This is the course of the right coronary artery. Okay, so you can clearly see here how it goes. Okay, this is about the course of the right coronary artery. Next, what are the branches of the right coronary artery? So the branches of the right conus artery, then sinoatrial nodal branch, anterior atrial branch, anterior ventricular branch, right marginal artery, posterior ventricular branches. These are the branches of the right coronary artery. So branch first I'll tell right conus artery. See, you can look here the right conus artery. Okay, the right conus artery, it forms an anterior arterial circle around the pulmonary trunk by anastomosis the similar branch left coronary artery. This arterial circle is called annulus venous. You can see here This artery, the small what you're seeing, that will anastomose with the branch of the left conus artery. So it forms a circle. So you can see here conus artery here. That is called a right conus artery. See here, it is clearly you can make out right coronary conus artery. Right conus artery, it forms an arterial circle around the pulmonary trunk by anastomosing with left conus artery of the branch of left coronary artery. Okay, next is the arterial branches. You can see these are the arterial branch here. These are the arterial branches. So the arterial branches, they are classified into anterior, lateral, and posterior group. One of the anterior arterial branches is called as sinoatrial nodal. This nodal branch forms a loop at the base of the superior vena cava. From this loop, a prominent branch arises. It is called a ramus crista terminal, which travels the SA node. So, you can see these are the minor branch running close to superior vena cava. They see here they call a sinoatrial nodal branch of the right coronary artery. Next, about the ventricular branches. So these arteries are classified. See, ventricle. This is a part what you see in ventricular branches. These are the ventricular branches which will reach up to the diaphragmatic surface of the heart. So these are the ventricular branches you're looking. Next, about the next artery, that is here, that is called a marginal branch of the right coronary artery. So right marginal artery, this branch arises from right coronary artery, crosses the right border of the heart. You can see this is the right border of the heart. It crosses the right border. This marginal branch will cross along the inferior border up to the epid. You can see this is the right marginal artery which reaches the inferior border of the heart up till the apex of the heart. So that artery is called as the right marginal artery. Then comes the posterior interventricular artery. See, ventricle between the two ventricles, that is called posterior interventricular artery. This branch arises close to the crus. Crus means where all this artery meet, like right coronary, left and the posterior, all they meet, that is called as a crus. This branch arises close to crus and proceed in the posterior interventricular groove. This is a posterior interventricular groove. The artery is accompanied by vein, okay, that is called a middle cardiac vein. The posterior interventricular artery gives many septal branches, and one of the septal branches supplies AV node. So these are the branches of the right coronary artery. So what are the branches of right coronary artery are? Right conus artery, arterial branches, ventricular branches, right marginal artery, and posterior interventricular artery. These are the branches of the right coronary artery. Okay, then we'll look into the areas of distribution where all it supplies right atrium, greater part of the right ventricle, small portion of left ventricle, entire conductive system of heart except the left branch AV bundle, posterior part interventricular septum. These are all the areas of distribution of the right coronary artery. See, this is the diagram you have to practice. See, you can see here, this is about the, see, this is the right coronary artery. So you can see it arises from the anterior aortic sinus, runs in the atrioventricular groove, inferior margin, and you can see dotted. Dotted means it is running posterior. So what are the branches arising from it? You can see SA nodal branches. See, one artery is called as conus artery. You can see it is anastomosed with the left conus artery. Next is the atrial branches. Next is the marginal artery which runs along the inferior border, reaches up till the apex of the heart. The most important thing of the artery is the one which is running posterior, called as posterior interventricular, means between the ventricles. You can see this is the posterior interventricular artery. So these are the branches of the right coronary artery. We have dealt about origin, the course and the branches of it, and then areas of distribution of the right coronary artery. N- Next, left coronary artery origin. So the left coronary artery arises from left posterior aortic sinus of ascending aorta. See here, this is taking origin from left posterior aortic sinus of ascending aorta. So then the course, how the artery runs. The artery passes between pulmonary trunk and left auricle. Okay, this is a left auricle. You can see here pulmonary trunk and the left auricle and enters left anterior coronary sulcus. You can see here it is entering into the into the anterior interventricular groove, otherwise called a left anterior coronary sulcus. Soon it will, you can see it is dividing. It will divide into 2 to 3 branches. You can see after entering into the group, it is divided into branches. So this is a course of the left coronary artery. From where origin, then between pulmonary trunk and left auricle, then in the left anterior coronary sulcus. Okay, then comes, we look into the branches of the left coronary artery. So the left coronary artery, the branches, first one is a branch running in the, you can see in the groove, is the interventricular groove, that is called as a anterior interventricular branch of the left coronary artery. You can see between, this is a ventricle and this is a ventricle. Between the ventricle there is a groove. In between the groove is a running the arteriosync, that is called anterior interventricular branch of left coronary artery. Okay, so if I tell you the description of it, it descends in the anterior interventricular groove. Here it is accompanied by the vein. Okay, that vein is called as a great cardiac vein. So the anterior interventricular artery is accompanied by a vein. That vein is called as a great cardiac vein. Okay, then the anterior interventricular artery gives following branches. So what are the branches from it? See, this is a, see the left coronary artery only, the branch of it is called as the anterior. So what are the branches coming from it? They are called as the ventricular branches. You can see here, this is a ventricular branches. Then called as the left conus artery. We have seen that the left conus artery is forming a anastomosis with the right conus artery. Then come the left anterior ventricle. These are the ventricular branches. Then septal branches. So these are the branches of the anterior interventricular artery. Okay, next one you have seen the left coronary artery, one branch is the this one. Okay, next we are looking into the next branch, that is called a circumflex branch of the left coronary artery. The artery traverses the left anterior coronary sulcus and then curves round the left border of the heart. It partly runs in the left posterior coronal sulcus. It terminates with the terminal branch of right coronary artery. Circumflex artery gives a following branch. You can see here the artery running. Okay, so see here it is running and reaches into the behind the heart. Okay, so the what are the branches coming from it? The one branches of the circumflex you are seeing, that is called as a left marginal branch of circumflex artery, left marginal artery. So this left marginal artery descend along the left border. You can see it is descending along the left border of the heart and reaches up till the apex of the heart. Then other branches are anterior and posterior ventricular branches. See here, anterior and posterior ventricular branches. Next is arterial branches are classified into anterior posterolateral and Kugel's anastomosis. Okay, so these are the branches of the circumflex artery. So, okay, to tell again, see first to write about left coronary artery origin. It arises from left to posterior aortic sinus of ascending aorta, then the course, the artery passes between pulmonary trunk and left auricle, and soon it divides into two to three branches. The first branch you are seeing, anterior interventricular branch, left coronary artery. It will run along the in the anterior interventricular groove. Okay, it gives out the branches. Okay, like right anterior ventricular branches, conus, diagonal branches. Okay, one of the largest branch of this is called as the diagonal branches. Then one more is the circumflex artery. The circumflex artery travels to the left anterior coronary sulcus, and there are branches. One of the branch of it is called as the left marginal branch of circumflex artery. So see here, you can see the branch clearly. See here the artery left. Then this is the branch. See, you are seeing that is called, here you can make out clearly. So that is the anterior interventricular artery. See, the ascending up, this is a posterior, it will run forming the posterior interventricular artery. One more is here, the branch from it is called a diagonal artery. This is the artery called as the circumflex artery. So these are the branches of the left coronary artery. You can clearly see in the diagram. Next, we look into the applied anatomy of the blood supply. Okay, first one is called as myocardial infraction. What will happen? Thrombosis in the coronary artery completely obstruct the blood for result in heart attack. You have heard about heart attack, right? So heart attack is a layman's word, but here we call it a MI, otherwise called a myocardial infarction. You can see thrombosis, you can see a blockage in the blocked artery. So if there is a blockage in the artery, means obstruct the blood flow, that will result in the heart attack. This is about myocardial. Mainly is the blood vessels. Okay, blood supply of the heart. So the blood vessel, if there is a blockage in the blood vessel to the heart, it will lead to myocardial infraction, otherwise called as a heart attack. Angina pectoris is a one more condition, that is incomplete obstruction in the coronary artery due to spasmodic contraction cause intense pain in the chest region. The pain can be referred along the left arm. That is called, what we call it as, if there is a pain in the left arm, that is called a referred pain. Okay, so you can see here how the patient is holding pain here, angina, a type of temporary chest pain, pressure or discomfort. This is due to the, see here, narrow artery. The arteries are getting narrowed up. Heart muscle, what will happen? Heart muscle is not enough oxygen due to narrowed coronary artery. It will get pain in the chest. That is called angina pectoris. This is about the obstruction of the blood supply to the heart. Next, now till now we have looked about the arterial supply of the heart. Next we'll look about the venous drainage of the heart. So the venous blood from the heart is drained, you know, the blood, so that the right atrium which will carry deoxys, so the blood from all this will reach into the right atrium. So the venous blood from the heart is drained into right atrium through these veins. These are the main veins, you see, they are called a coronary vein. Means the venous drainage of heart will be drained through these veins. Okay, they are called a coronary sinus, anterior cardiac vein, and this is called a vena cordis minima, otherwise called a Thebesian's vein. These are the veins of the blood from heart is drained into right atrium through coronary sinus, anterior cardiac vein, and vena cordis minima, otherwise called a Thebesian's vein. Okay, see here, for veins we always use the word called as a tributaries. So the first, what you can see about the first vein, you can see here, that is called as a coronary sinus. You can see here in the posterior in the groove, that is called as a coronary. See here, you can see it here, between posterior atrioventricular groove, you are running the vein, you are seeing, that is called as a coronary sinus. Okay, what see, coronary sinus, it is a venous sac about 2 to 3 centimeter long, situated in the left posterior coronary sulcus. Okay, see here, it is situated in the posterior coronary sulcus. It opens into right atrium by orifice, which is guarded by valve. Follow this is guarded by valve. So you can see now. Next we'll look into the tributaries of the coronary sinus. So what are the tributaries of it? You see one. It is called a great cardiac vein. The next one is a middle cardiac vein. So these are the tributaries of the coronary sinus. So first you look about the great cardiac vein. See, always it is from where it comes, okay. So the great cardiac vein, look here. Yeah, see here, this is a great cardiac vein, begins near the apex of the heart accountant and accordingly, and anterior interventricular with the artery accompanied by it. That is which artery? The branch from the left coronary artery, that is called anterior interventricular artery, and more proximally terminates at its end to coronary sinus. So see here, it will be terminating into the coronary sinuses. Next you are seeing the next, it is called as a middle cardiac vein. See here, this is a middle cardiac vein you are looking. This is a middle cardiac vein. It is accompanied by, you can see, this is a middle cardiac vein. So it is accompanied by artery that is called as a posterior interventricular artery, and then opens at the termination of the coronary sinus. So two vein now you learned. One is a great cardiac vein. Next one is a middle cardiac vein. Then the next one is called as the small cardiac vein. That small cardiac vein small cardiac vein, the small cardiac vein, if you look, it will accompanies the right marginal artery, runs in the atrioventricular groove and may open into right atrium. The next is the oblique vein of left atrium, runs in the posterior surface left atrium and drains into left end of the coronary sinus. Posterior vein of left ventricle and right marginal vein. Okay, this posterior vein or left ventricle runs on the, you can see here, this is a posterior vein or left ventricle, runs on the diaphragmatic surface left ventricle and ends in the middle of the coronary sinuses. Right marginal vein becomes right marginal artery and drains into small cardiac vein or directly into right atrium. So these are the veins of the these are the venous drainage of the heart. Okay, so to summarize about the venous drainage of the heart, so remember the venous drainage of the heart will drain into coronary sinus, anterior cardiac vein, and next is the venous cordis minimi. So coronary sinus, what are the branches of it? Learn about it. Great cardiac vein, small cardiac vein, middle cardiac, posterior vein of the left ventricle, oblique vein of the left atrium. Next, these are the veins arising from the coronary sinuses. Okay, thank you.